Question 1. A behavior analyst provides ABA services to a child. The child's parent is also a realtor and asks the analyst to use their services to find a new home, offering a significant discount. Ethically, the behavior analyst should A. Accept the offer as long as the service fee is fair. B. Decline the offer as it creates a potentially harmful dual relationship. C. Accept the offer but inform their supervisor. D. Accept the offer if the parent signs a consent form. Answer: B. Decline the offer as it creates a potentially harmful dual relationship. This question is about the ethical principle of avoiding dual relationships or conflicts of interest. A dual relationship is when a behavior analyst has both a professional role, providing therapy, and another type of relationship, like a business relationship as a client of the parent's realtor services, with the same person or family, even with consent. Accepting services from a client's family member can compromise objectivity, potentially exploit the situation, or impair the professional relationship. Ethical guidelines require behavior analysts to avoid relationships that could be harmful or exploitative, making declining the offer the most ethical choice. It's about keeping your professional role clear and unbiased. Question 2. You are examining a cumulative record graph of a student's correct responses during a teaching session. The line on the graph is completely flat for a significant period. What does this indicate about the student's behavior during that time? A. The student was responding at a very high rate. B. The student's correct responses were occurring at a steady, moderate rate. C. The student was not emitting the target behavior. D. The data collection was unreliable during that period. Answer: C. The student was not emitting the target behavior. This question tests your ability to interpret a cumulative record, a type of graph showing total responses over time. A cumulative record's line only goes up when the target behavior occurs. If the line is completely flat, it means that 0 instances of the target behavior were emitted during that time period. The total count isn't increasing. A steep upward slope indicates a high rate. A moderate slope indicates a moderate rate. But a flat line means the behavior simply didn't happen. Seeing a flat line tells you the behavior you're tracking stopped or didn't occur during that phase. Question 3. When conducting a functional behavior assessment, FBA, the primary goal is to identify the function of a behavior. Why is identifying the function considered so critical for intervention? A. It helps determine if the behavior is observable and measurable. B. It allows for the selection of arbitrary consequences to decrease the behavior. C. It provides the necessary information to develop effective, function-based interventions. D. It determines how often the behavior should be reinforced. Answer: C. It provides the necessary information to develop effective, function-based interventions. This question emphasizes the crucial link between assessment and intervention in ABA. The whole point of figuring out why a behavior is happening, its function, is to design interventions that actually work because they address the root cause. A function-based intervention teaches the person a better way to achieve the same outcome, get attention, escape a task, etc., or changes the environment so the problem behavior is no longer necessary or effective. Knowing the function allows you to choose strategies that target the purpose of the behavior, making them far more likely to be successful and ethical than just guessing or using arbitrary consequences. Question 4. A type of differential reinforcement procedure where you reinforce the occurrence of any behavior except the problem behavior during a specific interval is called A. Differential reinforcement of incompatible behavior, DRI. B. Differential reinforcement of alternative behavior, DR. C. Differential reinforcement of other behavior, DRO. D. Differential reinforcement of low rates, DRL. Answer: C. Differential reinforcement of other behavior, DRO. This question defines differential reinforcement of other behavior, DRO. The key idea in DRO is that you reinforce the absence of the problem behavior for a set amount of time. If the problem behavior does not occur during that interval, you reinforce the individual for whatever else they were doing, or simply for successfully completing the interval without the problem behavior. DRI reinforces a behavior that's physically incompatible with the problem behavior. DRI reinforces a specific alternative behavior. DRL reinforces the problem behavior happening at a lower rate. DRO is about reinforcing anything else, as long as the problem behavior doesn't occur. Question 5. Before starting any ABA services, including assessments and interventions, what is the most important ethical step to take with the client or their legal guardian? A. Conduct a preference assessment. B. Obtain informed consent. C. Complete a task analysis. D. Observe the behavior in the natural environment. Answer B. Obtain informed consent. This question highlights the fundamental ethical requirement of informed consent. Before you can even start working with a client, you must obtain informed consent from the client themselves, if they have the capacity, or their legal guardian. This means explaining the proposed services, potential risks and benefits, alternative options, and the right to refuse or withdraw, and ensuring the person understands and voluntarily agrees. Preference assessments, task analyses, and observations are all procedures conducted after informed consent has been obtained to guide the services. Consent is the critical first step. Question 6. You are measuring how many times a student speaks out in class. You decide to use partial interval recording with 1-minute intervals for the 30-minute class. You record a plus for an interval if speaking out occurs at any time during that minute. At the end of 30 minutes, you have 15 intervals marked with a plus. What can you confidently say based on this data? A. The student spoke out 15 times. B. The student spoke out for a total of 15 minutes. C. The student spoke out in 15 different minutes. D. The student spoke out throughout the entire 30 minutes. Answer C. The student spoke out in 15 different minutes. This question tests your precise understanding of what partial interval recording data represents. When you use partial interval recording and mark an interval if the behavior occurs at any point during that interval, your resulting score, 15 intervals with a plus, means the behavior occurred in at least 15 of the 1-minute intervals you observed. It does not tell you exactly how many times the behavior happened, frequency, or for how long it lasted, duration, within those intervals or overall. It only tells you during which intervals the behavior occurred. So, you know it happened in 15 minutes, but not how many times or for how long in total. Question 7. What is the primary purpose of using backup reinforcers in a token economy? A. To function as the tokens themselves. B. To provide the tokens with their reinforcing value through pairing. C. To be delivered contingent on the problem behavior. D. To serve as a discriminative stimulus for earning tokens. Answer B. To provide the tokens with their reinforcing value through pairing. This question focuses on the role of backup reinforcers in a token economy. Tokens themselves are conditioned reinforcers. They don't have natural value. They become reinforcing because they are consistently paired with access to things the individual does value, which are the backup reinforcers example snacks, activities, privileges. The ability to exchange tokens for these backup reinforcers is what gives the tokens their power. So, the backup reinforcers are essential because they are what the tokens are ultimately exchanged for, making the tokens reinforcing through association. Question 8. An experimental design where a baseline phase is followed by an intervention phase, and then the intervention is removed and baseline conditions are reintroduced is called A. Multiple baseline design. B. Reversal design, a BA. C. Changing criterion design. D. Alternating treatments design. Answer B. Reversal design, a BA. This question describes a reversal design, a BA or ABAB. The key characteristic is the return to baseline conditions after the intervention has been applied. Phase A is baseline, no intervention. Phase B is intervention. The return to A, removing the intervention, is done to see if the behavior reverses back towards baseline levels. If it does, it helps demonstrate that the intervention, B, was responsible for the behavior change. Multiple baseline introduces intervention across different behaviors, settings, or individuals. Changing criterion gradually changes the behavior requirement. Alternating treatments rapidly switches between conditions. The return to baseline is the hallmark of the reversal design. Question 9. Which procedure is used to increase the frequency of a behavior that the individual already performs, but not often enough? A. Shaping. B. Punishment. C. Reinforcement. D. Extinction. Answer: C. Reinforcement. This question asks about the fundamental procedure used to increase behavior frequency. Reinforcement, positive or negative, is the process where a consequence delivered immediately after a behavior makes that behavior more likely to occur in the future. If the behavior is already happening but you want it to happen more, you identify and provide a reinforcing consequence contingent on that behavior. Punishment decreases behavior. Extinction decreases behavior by withholding reinforcement, and shaping is used to teach new behaviors that don't exist yet. Reinforcement is the go-to for increasing behavior. Question 10. On a cumulative record, a decrease in the rate of responding is shown by A. A steeper slope. B. A shallower slope. C. A flat line. D. The line dropping down. Answer: B. A shallower slope. This question revisits interpreting cumulative records. Remember, the line on a cumulative record never decreases because it adds up the total count. A flat line means 0 responses. The rate of behavior is represented by the slope of the line. A steep slope means a high rate, lots of behavior in a short time. A shallower slope means a lower rate, less behavior in the same amount of time, or the same amount of behavior over a longer time. The line dropping down is not possible on a cumulative record, which only accumulates counts. A shallower slope equals a lower rate. Question 11. A behavior analyst providing ABA services to a family also starts a separate babysitting arrangement for the same child during non-therapy hours. This is an example of a potential ethical issue related to A. Confidentiality. B. Scope of competence. C. Professional boundaries/dual relationships. D. Integrity. Answer: C. Professional boundaries/dual relationships. This scenario directly describes a potential ethical issue involving dual relationships or maintaining professional boundaries, taking on a personal role, babysitter, with a client's family while also having a professional role, behavior analyst, creates a dual relationship. This can blur professional lines, compromise objectivity, create potential conflicts of interest, or lead to exploitation. Even if seemingly harmless ethical guidelines strongly advise against such relationships to protect both the professional integrity and the client's well-being. Question 12. When conducting an FBA, gathering information through interviews, questionnaires, and rating scales is considered a N. A. Direct assessment. B. Descriptive assessment. C. Functional analysis. D. Indirect assessment. Answer: D. Indirect assessment. This question asks you to classify a type of FBA data collection. Indirect assessments involve gathering information about the behavior from people who know the individual well, but without directly observing the behavior as it happens. Interviews, questionnaires, and rating scales are all examples of indirect methods because they rely on people's memory and reports of the behavior. Direct assessments, like ABC data, involve observing the behavior live. Functional analysis involves manipulating the environment. Indirect assessments are a starting point for gathering information and forming initial hypotheses. Question 13. A high probability behavior can be used to reinforce a low probability behavior. This is known as A. The law of effect. B. The matching law. C. The Premack Principle. D. Stimulus equivalence. Answer C. The Premack Principle. This question describes the Premack Principle. It states that access to a high probability behavior, something the individual is likely to do, can serve as a reinforcer for a low probability behavior, something they are less likely to do. The opportunity to engage in the preferred activity is made contingent on completing the less preferred one. Eat your vegetables, low P. That you can have dessert, high P. Dessert eating reinforces vegetable eating. The law of effect is a broader principle about consequences. The matching law relates response rates to reinforcement rates. Stimulus equivalence is about learned relationships between stimuli. Premack is about relative probabilities of behaviors as reinforcers. Question 14. A disadvantage of using whole interval recording is that it may A. Overestimate the total duration of the behavior. B. Underestimate the occurrence of the behavior. C. Be difficult to calculate IOA for. D. Only capture behaviors with clear beginnings and ends. Answer B. Underestimate the occurrence of the behavior. This question asks about a limitation of whole interval recording. In whole interval recording, you only mark an interval if the behavior occurs continuously throughout the entire interval. If the behavior starts and stops within the interval, or only happens for most of it, you mark it as not occurring. Because of this strict requirement, whole interval recording tends to underestimate the total frequency or duration of the behavior. This is why it's often used for behaviors you want to increase, like staying on task, because a high percentage in DOIR suggests significant occurrence. Partial interval overestimates. Question 15. When reinforcing a behavior on a fixed interval, schedule, the typical pattern of responding observed is A. High, steady rate of responding. B. A pause after reinforcement, then a gradually increasing rate, scallop. C. A high rate of responding with pauses after reinforcement, step-like. D. Low, steady rate of responding. Answer B. A pause after reinforcement, then a gradually increasing rate, scallop. This question asks about the characteristic response pattern generated by an FI schedule. On an FI schedule, reinforcement is available for the first response after a fixed amount of time has passed. Learners often learn this and pause responding immediately after receiving reinforcement, then gradually increase their response rate as the end of the interval approaches, leading to a scallop pattern on a graph. VRAR produces high, steady rates. FR produces high rates with post-reinforcement pauses, step-like. VI produces moderate, steady rates. The scallop is the signature of FI. Question 16. Teaching a child to say dog when they see a picture of a dog, and also when they see a real dog, a stuffed dog, or a dog on TV, is primarily an example of promoting A. Stimulus discrimination. B. Response generalization. C. Stimulus generalization. D. Prompt fading. Answer C. Stimulus generalization. This scenario illustrates stimulus generalization. The child is using the same response, dog, in the presence of different but similar stimuli, various types of dogs/pictures. The behavior, saying dog, as generalized across different versions of the dog stimulus. Stimulus discrimination would be saying dog only for dogs and not for other animals. Response generalization would be using different words or actions for the same stimulus. Prompt fading is reducing help. This is about the behavior happening in different contexts / with different forms of the stimulus. Question 17. Which ethical principle requires behavior analysts to take reasonable steps to avoid harming their clients? A. Beneficence. B. Non-maleficence. C. Fidelity. D. Justice. Answer B. Non-maleficence. This question asks about the ethical principle of non-maleficence. Non-maleficence means do no harm. Behavior analysts have a responsibility to ensure that their interventions and practices do not cause harm to the client. This involves carefully considering risks, using evidence-based procedures, and prioritizing the client's well-being and safety. Beneficence is doing good. Justice relates to fairness and equitable access. Fidelity isn't a core ethical principle listed in main ABA codes. Non-maleficence is the principle of avoiding harm. Question 18. A behavior analyst develops a program to teach a child to brush their teeth independently. They create a step-by-step list of all the actions involved in brushing teeth. This list is called A. Behavior chain. B. Task analysis. C. Behavior objective. D. Skill acquisition plan. Answer: B. Task analysis. This question defines a task analysis. A task analysis is the process of breaking down a complex skill, like brushing teeth, washing hands, getting dressed, into a sequence of smaller individual steps. The list of these steps is the result of the task analysis. This list, the TAE, is then used as the basis for teaching the skill using a chaining procedure. A behavior chain is the sequence of responses, but the list of steps is the task analysis. A behavior objective states the goal, and a skill acquisition plan is the overall program. The step-by-step list is the task analysis. Question 19. When conducting an FBA, if a behavior appears to occur consistently when the individual is alone and doesn't produce any obvious external consequence, like attention or items, it is most likely maintained by A. Socially mediated positive reinforcement. B. Socially mediated negative reinforcement. C. Automatic reinforcement. D. Escape. Answer: C. Automatic reinforcement. This scenario strongly suggests automatic reinforcement. The key clues are occurs consistently when the individual is alone, rules out social consequences from others, and doesn't produce any obvious external consequence. This points to the behavior producing its own reinforcement internally, such as sensory stimulation or pain attenuation. Socially mediated reinforcement requires another person to deliver the consequence. Escape requires getting away from something external. When the behavior happens when alone and doesn't get an external payoff, automatic function is highly likely. Question 20. When calculating interobserver agreement, IOA, what is the minimum acceptable percentage for research and practice? A. 50%. B. 70%. C. 80%. D. 90%. Answer: C. 80%. This question asks about the generally accepted standard for interobserver agreement, IOA. While higher IOA is always better, the common minimum standard for acceptable IOA in ABA research and practice is 80%. Some methods or research standards might require higher percentages, like 90% or 95%. But 80% is the benchmark often taught and used as a minimum indicator of data reliability. Below 80% suggests significant inconsistency in measurement that needs to be addressed before trusting the data. Question 21. Which procedure involves the practitioner physically blocking or interrupting a problem behavior as it is occurring? A. Extinction. B. Punishment. C. Response blocking. D. Timeout. Answer: C. Response blocking. This question describes response blocking. Response blocking is an intervention procedure where the therapist or caregiver physically prevents the individual from completing the problem behavior. For example, putting your hand up to block a hit or guiding a hand away from self-injurious behavior. This prevents the behavior from occurring and thus prevents the reinforcing consequence from happening. Extinction is withholding reinforcement after the behavior occurs. Punishment is adding/removing a stimulus to decrease future behavior. Timeout is removing access to reinforcement. Response blocking is a physical interruption. Question 22. When writing a behavior objective, it is important to include the condition under which the behavior should occur. This refers to the A. Antecedent stimulus or context, B. Consequence that will follow the behavior, C. Function of the behavior, D. Measurement system used. Answer: A. Antecedent stimulus or context. This question is about the components of a good behavior objective. A well-written objective should describe three main things. 1. The target behavior, observable, measurable. 2. The condition under which the behavior should occur, the antecedent or situation. And 3. The criterion for success, how you'll measure it and when it's mastered. The condition specifies when and where the behavior is expected to happen, like given the instruction clean up or during free play. This sets the stage for the behavior. Consequences, function, and measurement are important, but are not what is meant by the condition in the objective. Question 23. Which verbal behavior operant is controlled by a motivating operation, MO, and is reinforced by the specific item or service requested? A. Tact. B. Mand. C. Etroic. D. Intraverbal. Answer: B. Mand. This question defines the mand, a critical verbal operant identified by Skinner. A mand is a request, demand, or command. It is controlled by a motivating operation. Like being hungry makes food reinforcing and increases the likelihood of asking for foodie, and the reinforcement is getting the specific thing requested. Water please, when thirsty, MO, reinforced by getting water. Cookie, when hungry, MO, reinforced by getting a cookie. The MO driving the desire and the specific reinforcement are the hallmarks of a mand. Question 24. A potential ethical issue arises if a behavior analyst continues to provide services to a client when data shows the intervention is no longer effective, without making changes or seeking consultation. This relates primarily to A. Confidentiality, B. Professional boundaries, C. Maintaining competence/effectiveness, D. Integrity. Answer: C. Maintaining competence/effectiveness. This scenario touches on the ethical responsibility of behavior analysts to ensure their interventions are effective and to maintain their professional competence. If data shows an intervention isn't working, the analyst has an ethical obligation to reevaluate, make data-based decisions to change the plan, seek consultation if needed, or consider if they are the most appropriate provider. Continuing ineffective services waste resources and is not providing beneficial treatment, which relates directly to providing competent and effective services. Question 25. When assessing preferences using a multiple stimulus without replacement, MSDO method, chosen items are: A. Returned to the array for the next trial. B. Removed from the array for subsequent trials. C. Immediately delivered as reinforcement. D. Paired with a neutral stimulus in the next trial. Answer: B. Removed from the array for subsequent trials. This question asks about the procedure for the multiple stimulus without replacement. MSDO preference assessment. In an MSDO assessment, a set of items, usually 3 or more, is presented in a line or array. The learner chooses one item. That item is briefly delivered, and then it is removed from the array for all subsequent trials within that assessment. This forces the learner to choose from the remaining items in subsequent trials, helping to establish a clear hierarchy of preferences. Multiple stimulus with replacement, MSW, would return the chosen item.